Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with the series of neuro imaging concepts. So today we are going to talk about a new entity, that is hemorrhagic stroke. So neuro imaging concepts part 26, hemorrhagic stroke part 1, introduction. Hemorrhagic stroke, while sharing abruptness of onset, is distinct from ischemic stroke. By and large, ischemic stroke is very common. It is about 85%, where there is decreased blood supply to the brain. But about 15% is hemorrhagic stroke, wherein there is the vessel rupture and leakage of the blood. And one of the most important risk factors is, of course, hypertension. So hemorrhagic stroke differs from ischemic stroke in its abruptness of onset. It starts off suddenly. Patient is alright, suddenly he develops a neurological deficit. Very sudden in onset, always suspect hemorrhagic stroke. So hemorrhagic stroke, while sharing abruptness of onset, is distinct from ischemic stroke. Although there are many causes of non-traumatic intracerebral hemorrhage, hypertensive hemorrhage, subarachnoid hemorrhage, bleeding from vascular malformation, and hemorrhage associated with the use of anticoagulants account for the most cases. So what are all the causes of hemorrhage? The most important risk factors is hypertension. In fact, hypertension is the single most important and common modifiable risk factor for stroke. If you take a lot of risk factors for stroke, always hypertension stands first. Hypertension is the most important and common risk factor for stroke, be it ischemic stroke or hemorrhagic stroke. So hypertensive hemorrhage. Second is the subarachnoid hemorrhage. Subarachnoid hemorrhage is the bleeding from the aneurysms. It usually is seen in the subarachnoid space. And third is the bleeding from the vascular malformations. Generally, a communication between artery and vein is artery, arteriole, capillaries, venules and veins. But if there's a direct communication between artery and vein, we call that as an AV malformation. Most of the AV malformations are congenital in onset. So when there is a direct communication between artery and vein, there's a high risk of a rupture and causing hemorrhage. And how can we identify this on imaging? Generally, when we give a dye or a contrast, it goes to the artery, arteriole, capillary, venule, vein. So it takes a lot of time for the material to appear from the artery into the vein. But in vascular malformation, AV malformation, when there's a direct communication between the artery and the vein, when we give a contrast or the dye, it appears immediately into the vein, or the early filling or early dilatation of the vein is a very significant finding of vascular malformations. And another important risk factor for hemorrhage is the use of anticoagulants. We give anticoagulants. We may give warfarin, acetrum for any rheumatic valvular heart diseases, for atrial fibrillation. So when we give these anticoagulants, this itself can predispose a person to develop brain hemorrhage. So how can we differentiate the hemorrhage resulting from anticoagulants and hypertensive hemorrhage? Hypertensive hemorrhage, as I said, it is sudden in onset, whereas hemorrhage because of anticoagulants will take some time for it to appear. It may take over 24 hours to 48, because slowly the anticoagulants will lead on to hemorrhage, so blood will be slowly trickling down. So it takes a lot of time, 24 hours to 48 hours for hemorrhage to appear. And how can we see it on imaging? So since it takes a long time, blood slowly starts settling down and you can see a meniscus sign. So when you see a meniscus sign, it is suggestive of AV malformation, and the hemorrhage also will take a longer time to appear, like 24 hours to 72 hours. Bleeding from AV malformation, early filling or early dilatation of the vein when you give a material. So these are all the common causes of hemorrhage. The other important cause is a traumatic cerebral hemorrhage, where it can cause subdural hematoma or extradural hematoma. Extradural hematoma is usually due to an arterial rupture, middle meningeal artery rupture. So there will be a torrential bleed and it will go and compress the brain, but it will be well localized. Whereas subarachnoid hemorrhage is usually due to a venous bleed. Usually we see in elderly, they might have suffered some trivial injury, they might have even forgotten it, that must have torn a small vein and there will be slowly blood oozing out. So subdural hematoma, especially chronic subdural hematoma, may present over a long time, especially in elderly with a history of trivial injury and a history of dementia. All we need to do is to do imaging, take out the hematoma by taking a neurosurgeon's help, and person becomes alright. So these are all the common causes of hemorrhagic stroke. The non-traumatic intracerebral hemorrhage, the traumatic cerebral hemorrhage. The non-traumatic cerebral hemorrhage, we have hypertensive hemorrhage, subarachnoid hemorrhage, bleeding from vascular malformation, and hemorrhage associated with the use of anticoagulants. These account for most cases. Some cases may be due to cerebral amyloidosis and acquired or congenital bleeding disorders. They also account for a small number. Amyloidosis is usually seen in elderly and it is usually lobar hemorrhage. So if a person presents with hemorrhage in an elderly age, we should always suspect amyloidosis, and the clue is that it is usually a lobar hemorrhage. Unlike hypertensive hemorrhage, which is a basal ganglion hemorrhage like putamen hemorrhage. And there can be other acquired or congenital bleeding disorders which account for a small number. So basically, stroke, we have hemorrhagic stroke and ischemic stroke. Ischemic stroke is 85%, hemorrhagic stroke is about 15%. Very sudden, though both are sudden in onset, hemorrhagic stroke is more sudden in onset. So here you can see the basic the CT image, how we differentiate hemorrhagic stroke from ischemic stroke. As I said already, ischemic stroke is very common, 80 to 85%, and ischemic stroke, it appears dark on CT scan, black or hypodense on CT scan, whereas hemorrhagic stroke accounts for about 15 to 20% only. It is white or hypertense on CT scan, and you can see here it is basically confined, especially hypertensive hemorrhage is basically confined to the basal ganglia or putamen. Putamen hemorrhage is the most common site of hemorrhagic bleed. The other common sites of hypertensive bleed are: one is putamen, second is pons, third is cerebellum, and fourth is thalamus. So when you find hemorrhage in putamen, pons, thalamus, or cerebellum, it is basically a hypertensive bleed. But if you find bleed in lobar areas, especially in elderly, you should have to think of amyloidosis. So these are all the important concepts. This is an introductory lecture on hemorrhagic stroke. We'll continue with a few episodes on hemorrhagic stroke, especially the neuroimaging concepts. Important exam-oriented clinical neurology concepts I put in a book called Exam-Oriented Clinical Neurology, which is published by White Army. It is available. If you're interested, this book could be purchased, especially useful for students preparing for clinical neurology exams. The other book I've written is Focused Neurology. All important concepts of neurology I put in a question and answer format, which will be very useful for students preparing for oral exams or Viva exams. This book is available online from all leading booksellers, including Amazon. So if interested, this book could be purchased online. I hope you have enjoyed listening to my to these wonderful concepts of hemorrhagic stroke. If you have enjoyed, please like and share the YouTube channel, but please subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. The Dr. Sreenivas Medical Concepts is one of the India's leading neurology educational YouTube channels. Thank you. Bye.